Soon we'll be celebrating the 25th anniversary of Five Wishes. I couldn't have imagined when we first launched this document in Florida with Governor Lawton Chiles and Jeb Bush, and then later took it nationally when Eunice Kennedy Shriver joined me at the National Press Club to introduce its national version. I couldn't have imagined that it would lead to 40 million copies now in circulation in the United States, that it's available in 30 languages. If you're in the Los Angeles County Hospital, they have versions that are available for Hmong and Vietnamese, and for, of course, Cinco Deseos por ellos que hablan español. So we have seen Five Wishes as a useful planning tool to help families plan for and discuss end-of-life care and the kind of care they want during times of serious illness. Of course, this is a legal question. It goes to the heart of your rights under the Federal Patient Self-Determination Act of 1990, which often is ignored these days by healthcare facilities that have become increasingly more technology-driven and less personal, less human. It's very hard to find the same physician and nurse in some care settings. And so Five Wishes has helped empower individuals to have these discussions where they often feel a disadvantage. The first two wishes, of course, are the legal ones. That has to do with your living will and your durable power of attorney for health care. But I didn't write Five Wishes because I wanted to create a better legal document. I wanted to develop a document that addressed the personal and spiritual and emotional issues that attend end-of-life matters. And that involves wishes 3, 4, and 5. How comfortable I want to be, how I want to be treated, and what I want my loved ones to know. This simple little document, we've never raised its price in 25 years. We see it circulating, distributed by health systems, insurers, but also little churches and financial planners and employers that want to give their employees tools that they need. But it was the fifth wish that made me want to start this work. This wish that talks about what I want my loved ones to know. What I want my loved ones to know. And I'm happy to be joined today. Maggie and I have had a great discussion about questions about end-of-life care and about the emotional needs. And if you've gone to our Aging with Dignity website, you've seen how we treat these matters and how we encourage individuals to deal with grief and loss and caregiving matters. Maggie, I guess just to begin, you obviously care for people's emotional needs, and of course Five Wishes will deal with the medical needs. How do you feel Five Wishes fits into a person's own psychosocial understanding of end-of-life care and the challenges that come when bad news comes to someone you love?
Yeah. Well, when I first came across Five Wishes, it was very exciting actually, because I do think it does attend to people's emotional needs at this moment quite well, because I think what goes on is there is big momentous kind of events occurring here, you know, at this point in time. And that for people is, it can be confusing, it can be scary, it can be overwhelming. I mean, we've all kind of been there, I think. And I think what Five Wishes does is it sort of anchors that whole process for people. And I also think it's wonderful in the sense that I think there are less regrets, you know? I think really it provides people kind of a tool and a structure to stay focused on what's really important, to stay focused on the individual, and I think not get lost in what they need to be doing at a really pivotal moment.
And talk about what is it that they really need to be doing at a pivotal moment. What does that entail? What are the things that they should be thinking about and shaping their response to someone who's suffering, terminally ill, that means something to them in their lives?
When we're losing someone, we're experiencing strong emotions. You know, this is someone we love, we're attached to. We have a whole lot going on inside of us. And we're very attuned to that, many of us, very absorbed in that. And it can be hard to remember that our attention needs to be focused on the individual who's leaving, who's dying, and what they need and what they want from us. And sometimes those things are simple. You know, sometimes they want us to be in the room and be with them and be quiet, you know, just be present, you know. Sometimes those needs are physiological or bodily, you know. Sometimes they need us to advocate for them. Sometimes if they are feeling weak, they need us there to kind of let the medical staff know what they would want or need or interpret for them, you know. And It's hard to do that when we're having such strong emotions ourselves. Never mind whatever's going on in life outside of the room. And that's really what they need for, that our attention is focused on them, that we are seeing them, you know, and that we are slowing down and attuning to them and making sure that they're as comfortable as they can be physiologically and psychologically.